but they are definitely trying to prevent a bad Yelp review, a bad Google review. They really, really care about that. They really care about it more than you think. Yeah, forget what the mom really needs. Like, I just don't want her to leave me a bad review. It's crazy. Get her name. Get her name just in case. They gotta go. I'm tired of them.
There you go. If you have a crappy nurse, just tell her I'm going to leave you a bad Yelp review.
Girl, do you want me to put what's your name? Because I'm pulling my phone right now. Like Google. What is your name?
Hey, Mama Bear. Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jamie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in.
All right, so we have my friend Colette here. Colette my friend is a nurse, and she is a labor and delivery nurse. And she is going to talk to us today all about the golden hour and how you can really preserve that in the hospital, because we always talk about how important the golden hour is, but I think that is the first time as a new mom you are faced with having to advocate for your baby so often, and it's during a vulnerable time. So having the tools to really advocate for that time is so important. Colette, go ahead and introduce yourself and tell people why you do the work you do.
Well, hello. What's up, Jamie? I'm so happy to be here first off. And yeah, I'm a labor and delivery nurse through and through forever, I suppose, even though right now I am not in the hospital because I just feel like our vibes do not mesh, at least in the last couple that I've been to. Like lock me up. Sorry, I am patient-centered advocate. I do follow hospital policies and protocols. That does not mean I push them on patients or women or families. I just educate. I'm a huge educator and networker and all things birth work. I've been attracted to it for the last 13 years and knew I wanted to be in the birth space. But like so many people, I thought that meant hospital, and I thought that meant I could be a nurse. If I'm not a nurse, I would be a doctor, right? The word midwife or doula, just I guess in our culture, isn't used as it should be. And I was just uneducated when it came to that. So I said, well, I want to be part of birth. I want to be there for women when they're the strongest they'll ever be and the most vulnerable they'll ever be. And I want the skills to make sure that they get through that safely. I went to school, nursing school. I excelled there. I shockingly, because I was always felt myself as an artist, like a singer. I was in a band. I was more artsy, and I'm like, healthcare, no. But it's an adrenaline rush as much as going on stages, as being in the hospital or in a birth setting.
If you bring that energy on stage to the birth space, I think that is so powerful. That is so powerful for the moms that you're serving, because you, like me, I always said I don't answer to a hospital. I answer to God and the moms that I work with. And despite the fact that you have worked in the hospital, that has been kind of the way you have practiced as well. And I know that has kind of hurt you some. And I don't want to get too into that, just so we can focus on what is important here.
For another episode.
Yes. But if you do want to hear her story, she has the Birth Link podcast, and she has laid it all out there. You should go listen.
I did.
But
it's a popular episode.
I want to hear when you are serving mothers in that energy, showing up for them, not for the doctor, not to make them a good patient, not to protect the hospital, but for them. How do you support them in that golden hour, help them advocate for themselves, and kind of maybe just talk about the benefits of the golden hour, and then, what they can do to know when it's okay to let the nurses take your baby, how to tell them, no, you don't need to take my baby, and how to make sure that their baby is getting the absolute best care.
I love this question, and I think it needs to be understood and spoken about and planned about. First things first, the discussion starts way before the golden hour. This is like during your preparation with your partner, with your doula, with your obstetrician or midwife. Start discussing what right after the birth looks like for you. Whether you want to wait until the cord is white, or you want your baby on your belly and then on your chest. You want, plan that out like a perfect birth. Of course, if you go to a C-section, then things are going to be edited, right? But we're going to try to make the main focus of what you wanted, which is that connection and the introduction to breastfeeding, as natural and as close to your preferences as possible. So start early and often discussing it so that your partner, your sister, your doula, your doctor, they all know that this is like number one priority for you. When that moment that you meet your baby, after everything that you've done, the possibly years you've done to get to this moment is so special. Why are you not talking about it early and often? When you get to the hospital, if you are delivering in the hospital, this is where we get most of the friction, right? At home, you're going to get all the time you want. In the hospital, all of a sudden you're on their time and their rules, so you have to talk about this stuff. Talk to every single nurse that comes into that room that's going to be caring for you. Talk to her about your golden hour. Just, hey, can we talk for 5 minutes about my birth plan? I just want to really make sure that you understand and that you're on board and that we can do everything in our power to make sure that we get this. Whether it's coming from your mouth or your partner or your doula's mouth, it needs to be said, right? Maybe you're like, hey, when I'm in labor, I don't really want to be talking. Can you handle this? And you sign that role. But talk about it. When it's time, then so often baby gets put on the chest, and I have seen dads step in and be like, hey, we really wanted to wait until that cord was white, or hey, we want to do, so there's like in the podcast that I do, I have this first 15 series because there's so much that we do in those first 15 to 30 minutes, even right after you give birth, and you have no idea if you're not talking about it. We don't talk about it. So you have to have eyes on you. So maybe your partner needs to have eyes on what's going on. And sometimes they can't because they're also emotionally should be present for this baby. And so have someone else. I highly recommend having a doula or an advocate there, that's their whole job, is to make sure that you are getting that time with your baby uninterrupted. And so often we have a checklist of things. And so often there's going to be an outside nurse that's going to come in. We either call it a resource nurse, baby nurse. It's someone else that's going to come in that has no idea. Maybe she looked at your chart, but she may have not ever seen you before. And she comes swooping in and she has her checklist of things she needs to do. And she wants to take her over and bring her to the bed. And they're going to say, oh, would you like just the weight? Or they're just going to slip something that maybe will get you. Or why don't I take her so we can change your pads or do this and this? In that moment, you have the decision to say, okay, that's fine. Yeah, maybe you are like, can you take the baby? I'm a hot mess right now. I'm bleeding everywhere. I'm getting stitched up. Like, please take it, right? That's the conversation you guys need to have, with an understanding that is all they're going to do. Because so often they'll take the baby and then it's like 10 minutes later, we're like, can I have my baby? What's going on? Having that conversation, having those eyes, understanding where the baby's going and for how long, so that you can get your baby back ASAP, is going to be crucial. So having those planning ahead, having those conversations with all those nurses, because then your nurse is going to tell that new baby nurse, hey, skin to skin, we really want to promote this golden hour right now. Let's get baby back ASAP. You're going to have this, army of your team working to make sure that it's minimized as much as possible, and keep the lights dim, keep the noises quiet, not so much chitter chatter. Like, what is this golden hour mean to you? Those are going to be your top tips. Like, plan it, talk about it, and keep talking about it. And then when the time comes, hopefully you have built that team around you that's going to support exactly what you want. And you said, how do you know when is the time that we really need to take the baby? Well, they need to explain that to you very, very clearly. right? Is something wrong with the baby? Is something wrong with me? What exactly did you want to do? Like, you can tell me these things. I'm a functioning human being. I can understand because
Yeah.
this is prior. Is it something that you can do while I'm holding your baby? Most likely, yes.
Yes, most likely, yes. And that's the thing that I think is so frustrating is technically speaking, you can do everything on the mom's chest or at the bedside. I know it is not common practice in American hospitals, but there are some European hospitals, and I think there are a few American hospitals that have started it. Even resuscitation. Resuscitation can be done at the bedside. It can be done without cutting the cord. Like, that is what midwives do, right? Like, that is what midwives do at home. Like, everything can be done at the bedside. So if parents are listening to this and they know that, and it's like in their head, they know, like, okay, I know they can do it at the bedside, but they don't want to. Do you have any tips on how they can advocate for that, to get the hospital to do something that I don't want to say is necessarily outside of policy, but maybe outside of their norm?
Yeah, I'm excited to see that happening more and more. You have these little tables, baby tables that come right up to the bedside. I've seen them. Have I seen them in person? No. I'm just reading about it and I'm getting really excited for that. But it's a big ship to turn, and look, some of these nurses and doctors are just so um, like stuck on their ways of doing things that you have these nurses like, no, I want to do my checklist, and it's easier for them away from mom so they have the baby. But look, if we really think about it, like, Jamie, like, these babies have been curled up in the belly, their spine is been held like this, and you're gonna, like, 10 minutes after birth, take them to a bed and lay them flat, and then their bones, and they can't even crawl or turn around, and then they're crying, and you're like, yay, she's crying, that's good, it's gonna absorb the. No, she's crying because it hurts and she wants to be with her mother, and the mother is feeling this emotional detachment, like, no, I need my baby, I hear the baby. Maybe his mom's really tired or out of it, whatever. We look at the individual situation, right, and what the needs are of the baby and the mom, but they're more than what we think they are, and they're definitely more than the nurse's checklist. There's not one thing, if that baby is healthy and breathing, and even even when they need a stimulation stuff, there's everything that we need to do in those first hours, because it doesn't have to be just an hour, we can do right at mom's chest, and it's actually beneficial. If we can latch that baby, and your baby's latching and happy, then that's a great time for me to maybe check sugars or give an injection or something, because that the milk and the sugar is going to actually help, and just being next to mom and being safe is going to reduce how much pain they're going to feel. So you have to think about, like, it's actually for the baby and for the mom, without other things, without everything's considering other things like mom's mental state of
Yeah.
what she
No,
needs.
but it's letting the mom
We can
make
do
that
it at the
decision,
chest.
right? Not making it for
Yes,
her.
yes,
Not making it for her.
exactly.
And I feel like so many people
Exactly.
hear this conversation and they think that, like, oh, well, I don't mind if somebody takes my baby. And it's like, okay, well, that's fine if that's what you want. But for the
Totally.
moms who don't, or maybe you don't think that right now, but then you realize, oh, wait, don't take my baby. Like, you don't know. So it should be up to you to make that decision. Nobody should be using their authority to pressure you to fit their mold and their schedule. And we could go off on that.
Yes, and it can just be, I just really want to keep my babies next to me. Like, could these wait? Could this wait, or could you do it on me? I just thank you. I'm just gonna hold on to her, if that you
Yeah.
would. And you should say it one time, if at all, and then your partner needs to back you up, or whoever's there, like, hey, can we talk over here? And then really
Yeah.
get that space.
So
Yeah.
what I know a lot of, the hospital thing is, it is a bit of a factory. I hate to use that term, but that's the best way to think about it. Is the checklist has to be done because your nurse has to, within that first hour, usually by that hour point, sometimes 2 hour point, they have to get you over to postpartum because they need to get that bed open. And if you don't want them to, do certain things within that first hour, like you said, like, you have the right to say no. How do you get them to say, can they say, I'm declining this, can my postpartum nurse do this? Can they say that? Can they open that conversation? And how do you recommend they say those things in a way that doesn't make them feel like they're being a difficult patient, which I say be as difficult as you want to be. But how can they do that in a way that kind of feeds their desire to be a good patient while also holding their ground?
Yeah. I mean, well, take into consideration that it's the room is a priority room if it's a busy hospital, and there's moms that are needing to waiting in triage that could probably really use this room and that nurse, right? So take that into consideration. Take into consideration that moving to postpartum, yes, it's kind of a drag to get into the chair and move over, but once you're there, the bed is going to be way more comfortable. You're going to have still hopefully your private bathroom, and the dad will have a nice clean place to sit, and then your nurse will get you, your postpartum nurse can get you comfortable, and they probably won't be interfering as much as a labor nurse, right? So maybe the tension in the labor room of you having to ask or want more, like consider maybe just getting the hell out of there. Like, I'm just saying, maybe if they want to get you out of there, it's a reason. Or say, hey, is there any way we can maybe delay for another hour? Is that possible? Is it a busy unit right now? I just really would like, I can't even move. I still can't feel my legs much, or I just want, and you know what? If like the nurse is, that's an easy hour for me. So if we're not busy and there's no patients waiting, hell yeah, you can stay another hour. I can stall. Like, it's no big deal. Usually postpartum is going to be happy about that too. That means they have another hour to get things situated for you. You know what I mean? Like, we're as nurses, and we're still humans, and we still have a lot of stuff to do. We don't like to be rushed. So have that conversation. It's, you just got to ask. If you're not ready to move legitimately, just like, dude, I can't even fathom standing up right now, ask your nurse, like, hey, can we have another hour? Oh no, but maybe 30 minutes. You know what I mean? Like, they'll work. We're going to work with you. We're not brutal. Like, we're not monsters.
Most of you.
You just got to ask. Yeah, most of us. But most of us are not monsters. And you just got to ask. And then understand that if it is busy, or they are monsters, or they are bothering you, then maybe it might be in your best and your baby's best interest to get over the postpartum and get comfortable there. It's a clean bed, sheets, right, waiting for you, food, whatever you want is going to be there as well. I mean, consider it. And then you can have your 6-hour golden hour. You know what I mean? Like, keep it going. Get a nap in. Like,
what advice do you have for moms if they are dealing with a very difficult nurse who is very nasty and maybe giving bad advice, being rough with them, just making them feel like garbage? I know everybody says like, oh, you can fire your nurse, but we have understaffed hospitals. The reality is there are staffing issues. Firing the nurse, quote unquote, is not always a solution. I don't want to say it's not a solution or not an option, but it can kind of, parents may be afraid it'll label them as a bad patient. So then any other nurse that they get will treat them, come in with a preconceived attitude. Or, so what is kind of your, obviously it's super nuanced, what is your 30-second tip on how to handle a really shitty nurse?
Just have question in 30 seconds, but I would literally be like, are you okay? Yeah, you could just literally be like, are you okay? Are you okay? Like, what is the problem here? And then that's when you need to like tell your sister or your doula, or maybe not your doula, but like leave them as like, not, don't let them get in the middle of things, but your partner definitely can like go to the nurse's station when not in front of you, and have it like a little discussion with her, like, hey, listen, if your attitude right now is like not good, and if you don't have another nurse, then I'm just going to ask that you don't come into the room unless it's an emergency, and get us over to postpartum, because it's unacceptable how you're behaving, and I don't want this attitude coming in front of my wife and my baby during this precious time. So get it together. Like, he's got to pull out his big boy pants and go out there and make sure that, you know, I think of that knocked up movie. Like, listen, just, you could be mean to me, but don't be mean to her. Like, you're arming together, you know what I mean? Like, or connect with another nurse in there, because sometimes there's multiple. You'll have a tech in there, someone that you can connect with and talk to, and just kind of lean on her and try to, like, if that other nurse has to be in the room, like, zone her out, you know? I don't know. It's a really tough situation. Ask for the charge nurse. Like, if it comes down to it, if you don't want a confrontation, ask for the charge nurse. And I hope that she's better, but they are definitely trying to prevent a bad Yelp review, a bad Google review. They really, really care about that. They really care about it more than you think. So they want to
care about it a little bit more sometimes.
A little bit more. Yep, they'll do it. Yeah, forget what the mom really needs. Like, I just don't want her to leave me a bad review. It's crazy. Get her name. Get her name just in case. They gotta go. I'm tired of them.
There you go. If you have a crappy nurse, just tell her I'm going to leave you a bad Yelp review.
Girl, do you want me to put what's your name? Because I'm pulling my phone right now. Like, Google. What is your name? She'll be like, oh my God. What? Yeah, I'm putting your name, and I hope your manager sees this. And guess what? The managers see it. Dude, sometimes they'll, like, print them out. Not the bad ones, but the good ones. No, I've seen bad ones too. They print them out and leave it at the nurse's station for us all to look at. And they'll just, like, black out the names. And then it'll be like the daily game of finding out who the name was.
Oh my gosh,
who was on that
so
shift?
funny.
And Yeah. So we do take those things very seriously. And, maybe it's just, I hope she's just having a bad day and you guys can work it out at the nurse's station, or just like, are you okay? But if not, if she's just one of those monsters, like, talk to the charge nurse, and then you have the power in your fingertips of those reviews. I don't work for them anymore, so I don't care. Now you know.
That is hysterical. So on that note, I know a lot of people will talk about, like, oh, call the patient advocate. The patient advocate's there for you. What experience or insight or advice do you have on dealing with the patient advocate? Because I feel like I've heard different things. Like, I've heard people, like, absolutely have great experiences with the patient advocate. On the flip side, like, the patient advocate is still employed by the hospital. So there's that.
Yeah, I'm like, what is that? What's that? I've literally, the last few months, I've been hearing that more and more. And like, oh, the hospital has a patient advocate. I'm like, we do? We do? At 7 hospitals, I've never actually seen an advocate come in. Maybe that's just because it's me and I don't need it. I'm like, do they? But I've never heard of anyone calling for one. I honestly probably believe that's because they don't know that the hospital has one, because I didn't, and I worked there.
Well,
nobody told me.
I always wonder, like, do they actually do anything? Because I've personally never dealt with them either, and so I didn't know from the back end if you had any insight on that. Like, do they actually do anything?
I've never seen them.
Is that like a false sense of self-advocacy? Like, you think you've got this backup plan?
Bring your own advocate. You're gonna have an advocate that is hired and works for the hospital. I've never seen it. But now it's like, in the last few months I've been talking, because I'm getting certified as an advocate, but I'm not going to be working for the hospital. They'll fire me in 2 seconds. Like, what do you mean? Making sure I am an advocate. I am a nurse, and they tell me as a nurse, I am an advocate, blah, 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 blah. That's like the new word, right? Advocate. Okay, well, I am one, and I always have been one, but you're not listening to me either. So you're going to bring in another person. You don't think that that person is going to back up the staff in the hospital policy, and hospitals, all they're going to do is try to rephrase things. And it's more like crisis management, where there's going to be like, right? So that's how it has to be how it is, because the way they treat me as an RN, and I am an advocate, and it can't be much different than how they're going to treat an advocate that would actually advocate for you and your preferences, right? Like, they're gonna, I have to see it. Like, I don't take my word, because I honestly haven't. They don't even tell us that you have one. And then, because I'd be calling the advocate if there's the things I've seen from the doctors.
I'm sorry, you're getting a patient advocate call from the nurse? They'd be so confused.
Yes, because this doctor is crazy right now. Like, and he's not listening to the patient, and he's not listening to me. So if I could call an advocate to come in, I would. But I can't imagine that they would have the patient on my back. The doctor runs that show. And that's how I see it. So bring in your own, bring in one that is experienced in medical dialogue and interventions, someone like an RN that doesn't work for the hospital and will work for you, to be like, hey, listen, by law, you cannot touch her if without her consent, and she is not consenting. Like, where's the confusion, right? That's what you need. And I have to see it to believe it, to see a hospital advocate do that. You can also bring in ethics, involve the ethics department at the hospital as well if you feel like they've been violated. If anything, it's just to have it on paper.
After the fact kind of thing,
right?
Though, right? That's not something that's going to help you during the situation. That's going to be a 9 to 5. They come after the fact. You address it through bureaucracy and red tape. So yeah, you do. You need to have an advocate for you. And so I know that's what you do. You help parents prepare. You help them learn how to advocate for themselves. And you are stepping into that new role of being that advocate who is there for the parents. So can you tell us a little bit about what exactly it is that you offer, where people can find you if they want to take you up on that offer?
Yes. So if you want an advocate at your bedside, I highly recommend you get a doula that's near you. If you're in Los Angeles area, Ventura, and you'd like that to be me, girl, I'll be there. Just go to my website, myfriendsandnurse.com. Otherwise, if you're virtual, I can coach you throughout your pregnancy to be your own advocate. We meet weekly. It's a group situation, but I keep them very small. It comes with a full class, full course for you to learn about birth 101, mindset, of course, advocacy, building your birth plan, and then everything you need to know about labor and birth in the hospital. And then I have free workshops on Thursdays. You can always come talk about your birth plan with me and get like a little taste of what it would be like to be coached by me. And yeah, I mean, my big picture is starting this home health agency for maternal care and newborns, so we can kind of tie in this support that we have as doulas and lactation consultants, PTs, acupuncture, and then skilled RNs like myself that could come to your home and do IV medication, NSTs, diabetic teaching, postpartum assessments, newborn assessments. All of that stuff should be able to be in reach at your home and not just in the hospital or in the clinic. You get more one-on-one, more continuous care.
Yeah. I love that too, because there are so many parents who want to have a home birth, but they risk out of it for whatever reason. And this is a great bridge that they can have some of that prenatal care at home. And obviously you're not a doctor, but you can do some of those things that they would have to go off to this ridiculous hospital an hour away to do the NST and BPP and all this bullshit that they can't take anybody with them. And they've got 3 kids at home and their husband works. And
then they're not compliant. And then they're like,
not compliant, right?
Yeah.
I hate that.
You're like, I have 3 kids and I take 2 buses to get to the hospital. You want me to do this every 2 weeks? No, it's insane. And then you want me, and then you don't see me for 6 weeks afterwards, but I'm struggling the first few days at home. And why is the nurse not coming? A midwife would. So why not a nurse? Like, I understand the OB can't, so send a nurse. Like, we can kind of bridge those gaps. We can kind of fill that space that's so needed. So that's the big picture that should be popping up in a year. Until then, I coach virtually, and I probably always will. And I'm taking in-person clients as a doula and an advocate in my Los Angeles area. So myfriendsandnurse.com. Yeah, myfriendsandnurse.com has everything you need. And then, of course, follow me on Instagram, myfriendsandnurse. Message me. I'm super accessible, and I love what I do. And I just want to support women and birth workers and everyone that is fighting the good fight and speaking up, because it's so hard. And I love how you do that, Jamie. I know we connected really hard on that. And then, on the streets of Nashville as well. Good times.
If you want to get more of Colette's energy, go to the BirthLink podcast, because she lays it all out there, and you can just get a little taste of how amazing it is to be around her. Because let me tell you, this girl, she will bring the energy you need to your birth space. I wish that I had Colette with me in labor.
Yeah, I read a room. It's not that hard. You just read. I know when to be quiet, and I know when to, sing a song or tell a joke. it's the energy that's in the room, and we all need to be better at reading it, because it really is all about mom and that baby and that new family that's starting, and we have to just honor that so much. And it's not them entering our space, we are definitely entering their space. And so read the room, and if they need a joke or a song, or they just need a tear or a hug, or just me quiet in the corner, that's what I do, and that's
I
what
love
we should all
that.
do.
I love it. I love it. Thank you so much for coming, Colette. I feel like hearing you speak gives me so much hope, because I have definitely gotten very, I don't know what the word is. I can't figure out the word, but I know that I know there are good nurses. It's dated, I guess. I know there are good nurses. I know there are good doctors, but I have seen and heard and experienced so much bad.
Pushing us out, girl. They're pushing us out, but it's the business.
They do. They do everything they can to not let those good nurses thrive, and then they wonder why they're understaffed, and then they use that as an excuse for the shitty nurses to be shitty nurses. And so
toxic.
many moms are being hurt by this, but they should know that there are still good nurses out there.
And you can hire them to be with you. We're like,
and stand guard and call people on their bullshit.
Yes. And if it's not me, if you need someone in your area, like I'm sure Jamie knows some, and I definitely know some in different cities, and we're a support group. And even if it's virtual, we can't live alone. We can't do this alone. Being mothers is crazy. So get that support. Don't feel bad about it. We love it. That's what we're here for.
Yeah.
And
absolutely.
so much of it can be free. Yeah.
Honestly, there's so much that you can piece together, just like from your podcast, from my podcast, so much of it you can put together to learn so much on your own. And then when it feels overwhelming, that's when we come in and we just help you make it fit you and fit your personal needs. And that's what I hear so much from you, because I'm gonna be honest with you. I was so nervous to have you on the podcast for a long time, because I was like, I love Colette, but is she gonna come in here and be like super, super medical, whatever? But she's not, guys. Like, Colette is like, this is the medical reason for something. This is when we would need to do it. If you don't want to do it, that's fine, unless somebody's dying. And even then, you have a right to say no. I just don't recommend it.
Yeah, like I always tell, they're not consenting and and they're not pivoting, and that's the problem. No, it's not. It's not a problem. It's your problem. It feels like it's nurses that get angry because you want to keep your baby on your chest and they need to do something over here that can't pivot. They're the ones that can't pivot. They're the ones that can't use their hands and their brains to understand that you can do that stuff with mom. But they were trained this way, and the hospital, and they do it this way. And nowhere in the hospital policy does it say it must be done at this area.
Right.
No,
like nobody can think outside the box. I always say, for smart people, there's no critical thought. None.
Yeah.
Like,
it's
great,
crazy.
You were good at taking a test, and you're a trainable puppy. Like,
totally. Like the certificates and licenses and all of this just kind of makes me like. Like to think I have to get another license or another thing to be able to do this thing, but then that just means now we have this like guise of we know what we're doing, but we just shows that we were trained and we have like the foundation of it, where there's so many other people in the birth space that maybe they don't have the certificate or the license, but they're so much more knowledgeable in birth and autonomy and pet preferences and what you're capable of. So be very vigilant. Just don't think just because we have an ID badge on or the credentials that we have your best interests in mind, right? We most likely don't. We're just trying to get through the shift and check those boxes. Literally, I've been told I just have to check a box, because when I ask, well, why are you doing that? Right? From Pitocin to taking the baby away, from taking the baby. Yeah, I've seen them take babies away to go to NICU when it was absolutely not necessary. And you feel like your hands are tied, and it's such a. And I'm there like, why are you doing this? And then there's like, what are you going to do? What are you going to do? Change policy? Well, yes. I mean, yeah. Yes. we could talk about it.
Well, sometimes you don't even have to change the policy. Sometimes they just need to actually read the policy. The policy's already there. And a lot of times the policy is already protecting mom and baby.
If you guys get told that it's policy that they have to do something to you, that you have to accept it, I want you to ask for that policy. Yeah. Do you know how many times I ask for that policy just as a nurse? Like, postpartum will tell me, oh, you have to put a Foley and empty her bladder before you bring her over. I didn't know that. Can you please send me that policy? And I'll make sure I'll print it and I'll tape it up on the wall so that we can all see that policy, because I didn't know I had to do a catheter in and out for every patient before I bring, like, empty her. What? Guess what? Crickets. No policy. There's no policy. Like, trust me, we're over there like looking for it, right? Like, where are we supposed to empty your bladder like that? I think there's other things that we need to do to assess. That's on us to assess you. And if you don't let us assess you, then guess what? We say, patient understands the reasoning behind this and is declining. Good. My job's done. Okay. And there's other ways I can also assess and make sure that you're feeling good. Like, are you pale? Are you breathing? Are you lightheaded? Like, give me your symptoms. Maybe you don't want the blood pressure cuff going off every 15 minutes. You're like over it. You've been having it for 12 hours. You rip it off. You take, I really have to take your blood pressure every 15 minutes. It's policy. Good for you. Every 15 minutes, you can go right on that chart and say decline, because girl, I'm done with the cuff. What are we looking for? Okay, you're looking for my blood pressure dropping because I might be bleeding. Okay, let's just take a peek and see if I'm bleeding. And then I'll let you know if I'm lightheaded or, there's other, my point is to not just say no to everything. My point is to understand and that you have the option to say no. And we as nurses are smart enough to go around it.
I know. I can't tell you how many times as a doula, like, my client didn't want the fetal monitoring on constantly, and they were told, well, it's policy, can your be back, and blah, blah, blah. And it's like, okay, and I get that, but they also have the right to say no. And they would basically tell my clients, like, our policy is you either have to be wearing this band or you have to be in the bed. And it's like, that's not your policy. So I cannot tell you how many times, just to shut them up, I just followed mom around holding the monitor on her because she didn't want to wear the band.
Same, girl, same.
It's like, why? Why am I, I'm not a nurse. I get that a nurse doesn't have the time to stand there and do that, but it's not my job to make sure this child's being assessed constantly. But that's the position that people are put in, is like, they don't think they have a choice, or they're scared into it. Like, oh yeah, you have the right to say no, but your baby's going to die if you do. And it's crazy.
No, are you going to get in trouble?
Thank you so much, Colette, for coming and sharing so much of your wisdom.
One thing I want to add about what you just said, though, like, just remember that if you do want an intervention like an epidural or you get put on Pitocin, there's certain things that will come with that, which is like monitoring or blood pressure, whatever. So understand why, right? Okay, we need to put you on Pitocin. Well, now we need to monitor your baby and the contractions continuously.
Yes.
And we need to check your blood pressure. If you get an epidural, we may need to put a catheter. Understand that brain acronym and understand why, the benefits of getting it. Understand other options, right? So
right. And when you get those interventions, like you said, if you are choosing an intervention, there will be things that come with that you have to have that intervention. And that ends up getting into a gray area too. That's the thing. It's so nuanced. And that's why you need somebody who understands.
So I just want to make sure I put
corner.
that out there. Yeah.
No, I appreciate that.
One thing I would leave you on is with that golden hour. I have an episode on the birthing podcast about that golden hour too. And just we put as a hospital almost so much emphasis on golden hour. And then when you don't get it, or you get a C-section and then you don't see your baby for, 30 minutes or an hour, or your baby has to go to NICU, understand the benefit, what we're going for with that quote unquote golden hour. And you can get that whenever you get your baby and you're close. It can happen 6 hours later. Do you know what I mean? It can happen in NICU, skin to skin. It's a bonding. Understand what is behind the golden hour and not so much the name, like golden hour, right?
It's not just another box to check. There's a reason you're doing it. So as much as we don't want the nurses to be checking boxes, make sure that this is not just another box to check for you.
You know how many times the clock literally takes 60 minutes and they're like, okay, she got a golden hour. I'm going to take baby now and we're going to do all their stuff. And they're like, when I'm ready. Well, and maybe 15 minutes after birth, you're like, hey, can you just take the baby? I'm feeling
Honestly,
nauseous or no sick.
that was my favorite thing as like being an IBCLC and doula. Like the nurses would be like, oh, you're an IBCLC. Thank God, that makes my life easier. And they would literally check out and just let me like they were like, everybody's stable. I'm done. Like they're like, you handle that. I'm like, okay.
Great, thank you. Bye.
No,
Because
you
know more than us. Yeah, you know more than us. We know our place. Plus, we got a lot to do.
No,
Trust me, we're
exactly.
okay.
Right?
If you want to keep the baby, that's just like, okay, well, there's less for us to do. I'm so happy. I'm like, if you haven't come in natural birth, spontaneous, your water breaks on its own, you do like no epidural, girl, I am so happy. There's just so much less charting to do. Oh, you don't want me to do anything in the first hour? Okay, cool. Let me just peek and see, make sure your uterus is firm and you're not bleeding.
Honestly, though, like, why are there so many nurses that are like, no, we have to do all this? Like, girl, your job is easier if you don't do the things she doesn't want you to do.
They need to calm down. They need to calm, because the doctor's probably like calling every 15 minutes, like, we need to get her delivered. We need to get her. Because why? Because you don't want to wake up at 3 a.m. to come to like, come on.
He doesn't want to miss tea time.
Don't come then. It's fine. Whatever. All right. Well, yeah, that's my tip. Okay. Don't put too much pressure on that golden hour. More importantly is understanding what the benefits of it are and what you want out of it. And then you can get that, whether it's, a minute after birth or second after birth or 6 hours after birth. So that you can promote your own connection and breastfeeding and whatever that looks like for you.
Yeah, I always tell moms, it doesn't have to be perfect to be positive. So if it just isn't a perfect start, that doesn't mean there's no chance.
No, it's you're totally fine. Welcome to motherhood. Jesus, wait till they're 4.
Wait till they're 4, yeah. Well, thank you so much, Colette, for coming. Thank you so much for joining me. It was wonderful to have you here. I wish we could have talked for another hour, and I know we could have.
We'll schedule a time.
We need to do another one. We'll do another one.